Okay, so we're going to do an important recall for your Part 3 MRCOG exam. It's a simple one, yet it's important to know the station really well. The reason being the people who usually get a borderline points in the communication with the patient because they don't know how to explain these terminologies. So that's why I have chosen this topic as far as the oncology module is concerned. So the last time we have done an endometrial cancer, that was a complex topic. Give it a read, go through the YouTube channel as well. So this is a topic that I have taken now, and this is also very, very important recall. Yes, Dr. Hamada, you're ready to take up this task?
Okay.
Yeah, perfect. So this is your slide, and this is the only slide for you to go through, dear. Okay, ready to start?
Yes, ready. Hello, I'm Dr. Hamada, one of the doctors of Colposcopy Clinic today. Can I confirm your name and age, please?
Hello, doctor. I'm Laura Harper. I'm 28.
How may I address you?
Call me Laura, doctor. That's fine.
Nice to meet you, Laura. I understand you are here today because you want to know more about the test result, and I'm here to explain everything for you. But before that, I want to ask you a few questions more about you, and at the end, I will give you patient information leaflet. I will inform consultant about our discussion. It's okay to ask?
That's fine, doctor, but does the results show that I have a cancer? Why did they refer me to the colposcopy again?
Can you tell me what make you worse today?
Oh, I don't know. This is the second time I'm undergoing all of this, doctor, and this
Mm,
HPV, the smear test, what they're talking about. The same results I have had even last year, and I was referred to the colposcopy, and they said
mm.
everything is fine. And the second time they asked me to come in 12 months of time, and they have repeated it. So I'm really worried. Is it a cancer, doctor?
I totally understand how anxious you are and your worries, but I'm here to explain for you more information about your case. It's okay. And before that, I want to ask you a few questions more about your condition.
Oh, yeah, sure.
Can you tell me more about your complaint and if there is any complaint before?
I mean, I used to have some bleeding in between my periods. So, and
Mm-hmm.
then, that's how I was like, sent, I mean, I went to the GP. And then,
Mm-hmm.
I was also, I had to get this cervical screening done as well. And that's how they got to know that, the HPV has been detected.
Mm-hmm. And any loss of weight, loss of appetite,
No,
any chest pain, any water work problem, bowel problems,
no, nothing like that, doctor.
Excuse me, some question may be intrusive, but to formulate better management for you, and everything will be confidential. It's okay to ask,
Yeah, sure.
are you sexually active?
Yes, I am, doctor.
And how many partners you previously?
I had few flings, I don't remember.
Mm, mm. And any history of sexual transmitted disease?
To be honest with you, yes, I had chlamydia when I was 19, but then that
Mm,
just got treated. Everything was fine after that.
And any pain, bleeding, discharge during sex?
Yeah, sometimes I noticed some
Mm,
bleeding after the sex as well, but that used to happen last time, but now it's fine, I think.
mm. Any family history of special concern like cancer in the family?
Like what?
Like cancer of ovary, of breast, of cervix.
No, no.
Mm. Can you tell me more about your period?
Cycles have been regular, doctor. There's no problem there. The one I think I had one 15 days ago.
Mm. And you practice any contraception like combined pills?
I mean, we use condoms on and off
Mm.
whenever they're available.
Mm. Mm. And any family, any medical disorder, otherwise you are fit and well.
I am otherwise fit and fine, doctor.
Mm. And what about your weight and height ratio, BMI?
I don't know, but I have been thin all my life.
Mm. And do you smoke?
Well, I do.
Mm. Drink alcohol?
No.
Everything is okay at home. That's you have enough support at home.
Yes, I am. I am well supported.
Any drug allergy?
No.
You taking any medication at this moment?
No, nothing, doctor.
Thank you for sharing this information with me. Do you want to add any information I didn't ask?
Doctor, I had one miscarriage that was like,
Mhm.
roughly a year ago when I was diagnosed with this HPV and things like that. So, do you think that, I had that miscarriage because of this HPV?
And this miscarriage before? And have you pregnant before? Any deliveries?
No deliveries, but I had one pregnancy, and that was unfortunately, I mean, it ended up in miscarriage. So I'm really worried that is it the HPV causing the miscarriage? And, I'm really worried about that.
I will explain this for you. And also, what's your plan for future pregnancy?
I mean, I want to have a big family, doctor. Yes, I do.
And I'm sure you will be a great mother. Thank you for that. Now, after your permission and in the presence of chaplain, I want to examine you. I want to examine your general examination for your weight and hydration. And I examine your tummy to exclude any palpable mass or localized pain, and I will examine you from down below. It's okay.
Okay.
Now, coming to your concern, can you tell me what's your expectation for our discussion today?
I just want to understand whether it's a cancer or not because that's what I've read online, and I'm really worried about that why this test has come back positive again. Because my
Hmm.
colposcopy a year ago was normal.
Actually, Laura, from information I have gathered by your history and examination, and after confirmation of your name and age and address number, the test result, I'm so sorry, it is not a good news. I'm so sorry.
My
It
God.
shows that you have what we call high grade of this virus. It's called human papillomavirus. It is a common virus, but I want to assure you, it is till now not a cancer. It is a gray zone, pre-cancer stage. It is a gray zone between normal cells and sinister cells.
Pre-cancer? What do you mean by that, doctor?
It is a gray zone, not confirmed of a cancer, but it is a gray zone between normal cells and the cancer cells.
Oh, so
And
what is the percentage that it could be cancer then?
we need to do further investigation after this colposcopy. It's called LIDS. Am I
Okay.
curious? And during this procedure, before this procedure, we will exclude any pregnancy by pregnancy test and taking a swab to exclude infection. And this is a simple procedure, can be done under a local anesthesia, numbness of the area of procedure, or keeping you asleep if you comfortable for that. And we will discuss this with anesthetist. And removal of the area during colposcopy and the removal of large area of suspicious during examination, and this area will be examined under microscopy to exclude any sinister cells, and it is for diagnosis and also for treatment. After that, we will need to do what we call the test of cure after 6 months to ensure that all abnormal cells are present removed, and also
Again, I have to come after 6 months, doctor.
it is to confirm that everything is okay
Okay.
and to ensure that everything removed and for follow up. After this let's and this procedure, you can see what some bleeding, some pain, but it is advisable to avoid sex for some weeks, avoid swimming, avoid using tampons, hot baths, and if you have significant pain or offensive discharge or significant bleeding, it is a warning sign and symptom to come immediately to the hospital, and I will provide for you 24-hour per 7 contact number. Am I clear so far?
Yeah, it is. Yes.
Regarding your concern for miscarriage, actually, after LEDs, there is a risk of miscarriage, what we call a shortness of the neck of the womb. So, screening during pregnancy to avoid to avoid shortness of the neck of the womb, and if indicated, may the during pregnancy do what we called circulage. But this virus alone unlikely to cause this miscarriage before. Am I clear so far?
Mm, yeah, so you're saying that this is not something, that would have resulted in my miscarriage, right?
Yeah, it is unlikely to causing that, but after LEDs, you will be at risk of this miscarriage, what we call the shortness of this neck of the womb. That's need screening during pregnancy. Am I clear so far?
Yes, quite clear, doctor.
Do
And
you
your
have
time
any?
is up, Dr. Hamada.
Thank you.
Thank you. So let's see. Okay, just a minute. Yeah, so what is your reflection, Dr. Hamada?
I don't know.
So thoroughly, it did appear to me that you have read this topic and you clearly demonstrated that, I mean, across almost all the domains. So, however, the feedback is an important component of learning. So we will get into that in details, and because it has to be, it has to be addressed to everybody else as well. So, so your introduction and the rapport building was good. That you confirmed her name, age, the preferred way of addressing her, and you confirm the purpose of the visit as well, that you have done some so and so test and you're here to discuss the results. And immediately she asked that, is it a cancer, and then you asked her that what made you think like that. That was a good way of understanding her background. So you tackled it really well. And when she said that, yes, I had this particular test, an year ago, it was the similar results. And then, they're saying that again, I have got this HPV testing. I'm really worried it could be a cancer because the last time the colposcopy was reassuring. So that was the idea. So you understood that this is not the first time she's undergoing such a test. That means that she's partially having some information about this high risk HPV or a borderline cytology, and she also underwent colposcopy. So you don't have to get into the details of explaining the colposcopy. Otherwise, if she was the first to pay, if she's undergoing this test for the first time, and these are the results, then of course yes, HPV test has to be discussed in detail. Borderline cytology, colposcopy, all that would come. How do we do the colposcopy? What does the procedure contain? All of that. So that was good. But only thing is that address it that, it is not a cancer results. Let me reassure you, it is not a cancer results. So just you can say that one line instead of saying that I'll come to that. You don't have to go into explaining that what is HPV, what is borderline cytology, but at least let me reassure you. I can see that you're quite anxious. Okay. So let me reassure you, this is not the cancer results. And then you can go on to do your agenda. So the agenda was fine that I'm going to ask you a few questions, and then everything I will discuss or answer all your concerns, give you the written information, involve my consultant. So agenda making was also relatively fine there. And the reassure of the confidentiality right in the beginning, Hamada. You did that later before asking the sensitive questions, but try to do it because the examiners will be very impressed when you tackle about these, stations, oncology, fertility, the sexual and reproductive health. Try to do the confidentiality part bit early. Okay, before you move on to your information gathering, that some of I'm going to ask you personal and intrusive questions, and some of the questions you might find bit personal, but rest assured whatever we discuss here today will remain confidential, and then you move on. But you have done that in the middle of your sexual history. As long as you cover it, it is fine. It is just one input that you can do it in the right in the beginning. Okay, are we clear so far? Happy?
Yes, yes.
Yes. So as far as the symptoms is concerned, you asked that what led to this, last time colposcopy, was it picked up on a routine screening, or did she really have some symptoms? So what general symptoms that you would ask? She might be having some abnormal discharge. She might be having some postcoital bleeding or intermenstrual bleeding. She had all of that. She had an abnormal discharge. She had postcoital bleeding, intermenstrual bleeding. And that's why she underwent these, as a part of cervical screening, she was due. She underwent that, and these were the results. And because there was a borderline cytology, so you would have done the colposcopy at that time, and then since the colposcopy was normal, she was called back in 12 months of time, and these are the results. So you this much you understood. Then all the relevant questions you covered. Loss of weight, loss of appetite, bowel bladder disturbances, whether she's sexually active, whether she had any sexually transmitted infections, any postcoital bleeding, intermenstrual bleeding, family history of cancers. You also covered about her gynecological history, like last menstrual period, her cycles, what contraception she is practicing, but you did not address the contraception. Don't you think it's a most important patient safety point in here, Dr. Hamada?
What?
Contraception. Did you address
Uh,
the contraception?
I,
Simple.
I asked about the combined pills.
No, you asked what contraception she is using, and then I
Mm,
told you that I have been using the condoms whenever they are available, on and off. Okay, this is the
mm.
approach a young girl is having. So she's exposing repeatedly to chlamydia, HPV infections. This is also sexually acquired thing. So it's very, very important. So as a smart candidate, what you can do is that address it on the go, Hamada. You don't have to wait for your ninth minute. You can say, for example, you did not address the smoking, you did not address the condoms. So those are the two most important patient safety points, and you may get borderline. And if there are two borderline points, you may completely fail in that particular domain. So, what I can suggest you is that you can address it on the go. So, when you ask about the contraception, she says that, yeah, we use condoms, but not we are very regular with that. Address it. Condoms are good. These are the only methods. Emphasize on that. Adolescent or, the sexual reproductive health here. You have to give her the education. So, tell her that the condoms are good. These are the only methods that prevent sexually shared infections. So ask her to adhere to these condoms, consistently. She has to use them. And also, you tell her that if you need, I can also give you the written information on the most reliable contraceptive method. So, whatever the method she is going to choose, in addition to it, she has to use the condoms. So, address it there and there, Hamada, because what happens is that you may write it down on your notepad, or you may not write it down, and ultimately when you move to your ninth minute or 10th minute, you may completely forget it. There is a high possibility that you may forget it. So answer it on the go. And again, she was a smoker. You did not
So,
get into
so
that.
at the same time, should address how to use safely and also contraceptive.
So you can, sorry, I didn't get your question.
At the same time that she said that you not use condom regularly, I will advise here regarding how to use condom regularly and like that.
Exactly. Condoms are the most important patient safety point because she's getting these infections repeatedly and
Mm,
she's not in a stable relationship. She's
mm,
having the multiple sexual partners. So instead of asking that how many partners you had, that becomes very judgmental. You can ask something like, did you have any other partners in the past? How
mm,
many partners may become judgmental? So there are,
mm.
if you give exams in the UK and also, they will be very, very, very particular about this, and they may give you borderline communication with the patient because you're being judgmental. So that's the one of the criteria. So you can ask like, are you sexually active? If she says yes, okay, did you have any other partners in the past? As simple as that. Okay, that is one thing. And when you ask about the contraception, when she says that I'm not using the condoms regularly, or even if she says that we use condoms, you have to emphasize on that, saying condoms are the only methods that prevents the sexually shared infections, and it's important that you continue to adhere to them in addition to any other effective contraception. So address it on the go, even though you're doing an information gathering, address it on the go. Okay,
Okay,
don't wait
okay,
for your ninth minute. And about medical conditions, you covered BMI, you covered addictions, you did not cover the drugs. She might be doing a drugs, and this station might be all about, maybe you have to, occasionally she might be using some cannabis, occasionally she might be using some weed. So it's important that you cover all, especially in these age group. I'm not talking about in 50s, 60s. So at least in 25, 28, year old. And, it's very, very important to understand whether they're doing the drugs as well. So do the smoking, alcohol, and the recreational drugs as well. Okay. And when I said smoking, just ask her that, how many cigarettes in a day. Okay. And the next question should be whether she has attempted quitting smoking any time before. Okay. And then it is important to tell, always remember, whenever you get the cervical screening stations, she will be a smoker. Most of the time, this will be clubbed. The reason being, one, you have to address the smoking as a general health. Okay, it increases the risk of cancers. And third thing is that it causes the persistence of this HPV infection because her immunity will be reduced because of the smoking. So the HPV may not regress. HPV may not be cleared out of her body if she continues to smoke. So that's the important, the patient education you're supposed to give, and it will be looked as a patient safety point. So don't wait for your ninth minute. You have to address it. Okay. I know it is difficult, but if you need any additional help, we can put you in touch with NHS Stop Smoking Services. We can discuss the alternatives like nicotine replacement therapies. Okay. There
okay.
and there you addressed off. So obstetric history you missed. I had to prompt you, like, I had some miscarriage. So is it because of the HPV infection? That was fine. You addressed it. Examination was fine. Examination, we are supposed to take some swabs as well and ask her to follow up in a gum clinic because we don't know. She's saying that I had a multiple sexual partner. She's coming in that age group, 25 and above. uh, and it's important to mention about the swabs as well. Okay, it's not important that I will feel your tummy and exclude some masses and see if there is any painful points and all. That's not important for me. For me, the important point is the swabs. Okay, so that you should mention. So information gathering was almost, you covered everything. So you get a pass from me because your information gathering was almost pretty complete. But you almost took like 5.5 minutes. So try to work on your speed as well. Like try to take the quick history. Don't wait. Don't keep thinking what to ask next. That's the only thing. Okay, Amada, happy? Anyone wants to add anything to the information gathering, guys? Dr. Basma, Fatima, Sani, Homera, Maria, anything? Clear, everybody, at least say that.
Yes,
Yes,
ma'am, it's
ma'am.
clear.
Okay, perfect. So as far
Yeah,
as you know,
uh,
explanation is concerned. Yes, sorry, yes, go on.
yeah. I just wanted to say that, ma'am, when you just asked him regarding the is it cancer, so he had to reply then and there. He didn't
Yeah, you can
address
just
this.
say that the results doesn't show any cancer at the moment. Please reassured. I'm going to discuss your results in detail in a while. That's it.
Another, you asked him that is this miscarriage because of HPV? Then
Mhm.
again, he didn't address at that time
He
that
did
whether
not
it is.
address it at that time. That's what I'm saying. So, if the examiner is very strict, they look at it as a dismissing the concern, but then eventually he addressed it. But when I was giving exams, I used to miss it out. I mean, I was not registering because there were so many questions and
Yeah,
there were so many things that you're supposed to address. So, you may forget it later. So, that's why I always used to address it on the go. Okay, if she asks like, does the HPV cause? Answer is simple. You know it, right? HPV doesn't cause any miscarriage. So it causes miscarriage. It could be, it puts her at an increased risk of miscarriage or second trimester abortions if she has undergone any less procedure. Just because she's carrying the HPV infection doesn't mean that it increases the risk of miscarriage. You know that. So say this on the go. Why do you want to say like, oh, I will come to it later? There's a high possibility that you may forget it later. Okay,
yeah,
because she may
yeah,
not, because I'm a mentor now. I know these are the questions that needs to be addressed by you. I will ask, but then the role player, it may not be important to her whether you answer, you don't answer. So she might ask one or two times, and if you don't answer, she will just move on. So that is why I'm asking. The role players are very, they vary when it comes to the performance. So that's why I always tell that answer it on the go, so that you would have addressed it also, you would have gotten that marks under applied clinical knowledge, and you don't have to come back to it later. Okay.
yeah, yeah,
Yes,
right.
perfect. So, so that's the same thing that if role players. So in the beginning itself, that you told that I'm going to address, and I was okay. But there are few role players. You may say she may become very restless, and she may become very anxious and ask you that she will not let you proceed with the information gathering, and she asks you like, "No, doctor, just tell me, is it a cancer? Is it a cancer? This is the second time they're asking me to undergo colposcopy. What exactly is this?" So you tell her that what exactly is a high risk HPV. So high risk HPV means, so basically it is a HPV infection. It's a very common virus infection that is acquired sexually, and most women, and 90% of the women will acquire this infection. But our body, our immune system naturally clears it up. And the cytology, it says it is borderline. What it means? So you were saying gray zone, gray zone. You can practice this line, Dr. Hamada. That means the cells look slightly abnormal. Okay, they look slightly different from what it is supposed to look like, and it is usually caused by the HPV infection, because HPV infects the cervical cells, the cells within the neck of the womb. And when this happens, the cells look slightly different, and that is what we are able to see it here. They are not saying that it is only borderline, so we don't know what it could be. So you also had a normal colposcopy last year, which is reassuring. So this time we take this seriously because uh, if at all we pick up something abnormal or a sinister changes, then we want to monitor you very closely, and we can treat them early even before they become sinister. They are not saying it is a CIN2. They are not saying it is a CIN3 yet. It could be CIN1, and it can get cleared as well. So we don't know. So why did you want to do it like a breaking bad news here? She's having high risk HP because it's only 12 months. We can give her time up till 24 months. We can expect the HPV to get cleared in 24 months of time. So all we need is that, because the cytology has been persisted, the HPV has been persisted, that is 2 consecutive times. So we are referring her to the colposcopy. Whenever we see the cytology is abnormal, it is borderline, or it is some low grade, anywhere, we refer them to the colposcopy, just to making sure that there is no CIN2 or CIN1, 2, 3. Okay, so don't do it like a breaking bad news. So it's just that we are doing it so that we want to monitor closely. If at all we pick up something, that can be treated early. That's the goal in here. So information gathering, almost you covered everything. It's just that you make sure that the current contraception has to be addressed. It's very, very important that, giving her the sexual health and that the belief of that HPV has caused her, miscarriage. So demonstrate empathy. I'm really sorry that you went through the miscarriage, but that's a very really valid concern. But HPV doesn't cause any miscarriage, and the HPV mainly affects the cells within the neck of the womb, and so it doesn't cause any harm to the pregnancy or the baby. So that's what you're going to tell there. So information gathering was fine there, and then communication with the patient was, I will come to that. So how to explain this? So it's the same thing, that HPV is a viral infection that is acquired sexually, okay, and it is expected to be cleared out of our body from our own immune system. So the immune system naturally starts clearing it within 1 to 2 years. This, just because she's having high risk HPV doesn't mean that she has a cancer, okay. And it's not a high grade also. They are not saying it's a high grade dyskaryosis. So they're saying it's a borderline. It could be borderline squamous also. That information is not given in detail. So you tell her that some of these cell changes will naturally return to normal without any treatment. It's just that we need to be more cautious. So we want to do the colposcopy, making sure that we are not missing out anything. And if we identify anything, we can treat it early. That's the whole goal of this particular procedure. And again, smoking and unsafe sexual practices, you guys have to address it, because the smoking, it increases the risk of progression to the cervical cancer. It's very, very, very important patient safety point. You have to tell her. So it increases the risk of progression to the cervical cancer. So if you wish, we can put you in touch with NHS Stop Smoking Services and also adapt safe sex practices, which has to be a barrier methods. So management, you told her, you did not get into the colposcopy detail because she knew, but you can ask one question, that are you aware that how the colposcopy will be done? So basically the colposcopy, if she is aware, you don't have to go into the details. So if she is not aware, you can tell her that colposcopy is basically a simple procedure where we try to look at the cervix closely, okay, neck of the womb, using a special microscope, what we call colposcope, and it will be done in a specialized colposcopy clinic. Anyway, she is in a colposcopy clinic, so it will be done here by the specialist. So if she is aware all of this, because it's the second time, you don't have to get into the details. But if she's undergoing this procedure for the first time, then you have to explain. So what are the possible outcomes here? So you explain that. So we try to look at it. If there are any abnormal areas, then we take the biopsy. But if it is normal, then we may have to discuss this with a MDT. So why do we do that? So it all depends on what we see on the colposcopy. So depending upon that, we are going to do the procedure. That is LETS procedure. This you explained really well. I was happy. And you also mentioned about what to do, what not to do after the LETS procedure, right? You told about the colposcopy, you told about local anesthesia, that is basically we give the numbing injection. And then after the procedure, she may experience some slight spotting, or she may have some discharge for about few days to weeks. And then she may experience some cramps, okay, like a period like cramps. So you can give her some paracetamol for that. And then you also, to prevent the, because that area will be a bit raw because we have done the biopsy. So to prevent the risk of infection, what all she has to avoid, that also you mentioned, avoiding sexual intercourse, avoiding swimming, using any tampons or vaginal creams, or bubble baths, all that she has to avoid. So, and also safety netting also you did, that if she experiences any fever, persistent unusual discharge, persistent bleeding, if the discharge is smelly, then she has to come back to us immediately, and you will give the 24 hours emergency contact number. Okay. And risks also you mentioned that having had a LETS procedure, it puts her at a slightly increased risk of narrowing of the cervix or shortening of the cervix, puts her at increased risk of miscarriage, especially the second trimester miscarriages. So we closely monitor her cervical length in the next cervix, at least the mid-trimester cervical screening we're going to do. And if it is short, then yeah, we discuss the options like vaginal progesterone, or we discuss the option of cervical cerclage. All these points you covered, Hamada. I was very happy about it. Okay. The safety informations, of course, the follow-up also you mentioned that, depending upon what we see, then we are going to do the test of care. And if it is abnormal biopsy, then we discuss with the MDT and clear, follow-up plans we're going to give her. So referring to the smoking cessation support services is also important, and sexual health services. So taking swabs for the STIs, asking her to follow up in a gum clinic. So these are all very important buzzwords, and give her the patient information leaflet. You almost covered everything in here. So what did you miss as a patient safety points, Dr. Hamada? Yeah.
Mhm. Um,
So what did you miss?
I miss condom,
Yeah.
and they refer to also smoking cessation surface,
Yeah.
and I miss refer to gum clinic.
Yes. So swabs, gum clinic, condoms, they all come under the sexual, health education. And then you missed about the smoking. Those are most important patient safety points. And also do not do it like a breaking bad news that I have got a bad news. We don't know yet. High risk HPV is positive. It could be positive and we expect it to clear maybe after a year. Maybe she might become norm negative after 12 months of time. We don't know. So it's only a borderline cytology. So don't do it like even if they give you high grade, do not think like do not discuss it like it is high grade. You just say the cells are dividing rapidly and they look abnormal. So we want to make sure that we are not missing out any bigger picture here. We are not missing out any abnormal pathology. So that is why we want to make sure by visualizing it directly on the colposcope, and if we identify any abnormal areas on the colposcope, then we take the biopsy. So basically discuss it like that. Anyways, high grade, it's a straightforward, let's procedure if the colposcopy is satisfactory and adequate. So let's procedure is something that we are going to do it. So do not discuss, be it a borderline or be it a high grade pathology, do not do it like a breaking bad news. That's what I'm trying to say. All right.
Okay.
So, and it's not like a pre-invasive pathology, like a pre-invasive cancer. We are not talking about CIN1, CIN2, CIN3, which is basically a colposcopy, after the colposcopy, which is a histopathological diagnosis that we are going to get. That's the colposcopy guided biopsy results. So don't do it like this is pre-invasive just because they have got high-risk HPV and then they have got a reflex cytology that has come positive. Okay, that is also something you have to remember. Any question? Well done, Dr. Hamada.
Thank you. And regarding applied knowledge,
Yeah, so applied clinical knowledge, you covered everything, my dear. So you covered that she requires a colposcopy. It will be done under local anesthesia. She requires a LETS procedure. Depending upon what we see, the suspicious abnormal areas, we're going to do the LETS procedure for her. And then the follow-up plan you gave her, safety netting you did, what she can expect after the procedure, everything you covered. So almost applied clinical knowledge you get a pass. Communication with patient, you get a borderline. Communication with the colleagues. So I wanted you to mention, consultant you mentioned, but I wanted you to mention the GP. I wanted you to mention about the colposcopist who is the specialist. Okay, so that is something I wanted you to mention. Okay, and then patient safety, you get a fail because you forgot to address all the two to 3 points there. Okay. Yes.
okay.
Perfect. So any question from anyone from the group? Any question? Dr. Soumya, clear?
Yes, ma'am.
Okay. Nazia, Maria, clear? Basma, clear?
Dr.
Yes.
Deepika, can I ask you something?
Yes, yes, please.
Hello. You said it's a fail on the patient safety side. Is it
Mhm.
really a fail? Like, I think, uh, is it a complete fail? Like, he didn't address smoking and perhaps some
Yeah, see how
other.
it works is that the domain-wise marking, how it works is that, so generally we will have a couple of patient safety points. Okay. So how the RCOG looks at it is that if those important points, so if smoking is not addressed, it's a borderline point. Say, for example, this has been awarded as a borderline point. So if smoking is not addressed and the patient continues to smoke, so, and then it might progress, the HPV may persist, she may progress to SEIN1, to 2, to 3, okay, and then she will come back and tell like, oh, nobody has addressed, nobody has told me that smoking was bad, I should have quit the smoking, it would have, progressed my cancer. So that's how retrospectively they analyze that how it is linked to the progression of the cancer, and we as doctors should be addressing it. So if the RCOG puts it as a borderline criteria, that is one borderline point. This I'm talking about domain of patient safety. If they say that address, the sexual practices, that addressing, adherence to the condoms or the swaps, the condoms. Let's take only the condoms. That he did not address the condoms in here. Then of course she's going to acquire the sexually transmitted infections. There will be that the education part you have not done properly to them. So because she doesn't know that the condoms are the only methods that prevent sexually transmitted infection, she doesn't know that using it very strictly is very, very important to prevent the sexually transmitted infections, that too having had a multiple sexual partners, or if there is any change in the partner in the last 6 months to a year. So if the RCOG gives it as these are the borderline points, and you have missed one borderline point of smoking, addressing smoking, and second borderline point, addressing a second borderline point of the condoms, the barrier methods, then two borderline points will get you the fail. That's how the marking works. So why do you think that it shouldn't be like that? Any particular concerns you have got about this?
No, actually, he did very well to begin with, and I thought that he might pass. So when
Yeah,
surprisingly at
he
the end,
passed across almost all the domains. He passed the information gathering. He clearly passed the applied clinical knowledge as well. So it's the domain wise marking, dear. So it doesn't mean
uh,
that the patient safety he got failed, doesn't mean that he entirely flunked the station. Doesn't work like that.
mhm.
It's basically always the domain wise marking. So he would have
So
clearly
how
passed the
about
control
how
station.
about the total score which he had? Is it a pass or is it a fail?
So no, he would have, we will never give the station as a pass or a fail. Have this in your mind. We never, even the RCOG for that matter, it's the complete score we are going to get out of 14 stations. So in the 14 stations, in a communication with the patient, how much he's got, communication with the patient, how much he's got, communication with the colleagues, how much he's got. So if he's persistently flunking in the similar domain, there's a high possibility that he may completely fail that particular part 3 MRCOG exam. It is never the station wise. That is why I always tell people that even if one or two station go bad, don't worry. It is not like you would have flunked that station altogether. Maybe you would have got a borderline in few stations, in domains. Maybe you would have got one or two fail in some of the domains. Doesn't mean that you have failed that station. Of course, he has passed because his score will be like almost 7 to 8 out of 10 scoring. So it is never a pass or a fail per station. It is always domain-wise marking. So that is why even if you don't know any station, try to get the history done. Get that information gathering pass. Try to do how much ever the communication with the patient, how much ever you can. So try to get that particular domain pass and try to involve everybody on the board, consultant, GP, whoever is important in that specialist. Get that communication with a colleague domain pass. That is what we are trying to say. So it's never, you cannot aim for the entire station. You have to aim for those domain wise marking. So now you should start, because even when you go through the answer template, why do we give the answer template as this domain and domain of communication with the colleagues, domain of communication with the patient, domain of communication in information gathering? Why do we give the answer template like that? Because the marking is according to the domain. Understood now?
Thank you so much. Thank you.
Yes. So definitely he did he did the station really well. So it's only the domain wise marking, because he has already given the exam before. He knows how the domain wise marking works. So he's asking that, did I pass that domain? Did I pass this domain? Yeah? Yes. So, ma'am, should we tell about like CIN1, CIN2, CIN3 management and follow-up? So that's a far-fetched thing now, okay? Because we don't know what we are going to get. So you tell her that depending upon what we see on the final histopath results, okay? So we advise her the follow-up. So be it a CIN1 or be it a CI2 or a 3, only the follow-up changes. Nothing else will change there, isn't it? If it is a CIN1, what are you going to do? You will call her back in 12 months of time. If it is CIN2 and a 3, I'm not talking about CGIN, which is glandular intraepithelial neoplasia. 2 and 3, you're going to call them, you will have one test of cure. So you will call them in 6 months of time. If it is like cystic glandular intraepithelial neoplasia, which is completely excised, then you will have two tests of cure, which is one is at 6 months and then 12 months from the first one, or 18 months from the beginning. So So it's always the follow-up changes. So you don't have to get into the details. You can just say that depending upon the histopathology results we're going to see in the final outcome, we will decide the follow, whether you have to come in 12 months or whether you have to come in 6 months, whether you have to come in, twice occasions, just to make sure that everything is clear. Okay? Understood? Dr. Nazia?
Yes, ma'am. Thank you. Thank
All
you.
right. Okay, so we are going to take up the cervical screening. Any question, Dr. Hamada, from your end? Do you agree with me about the domain-wise marking?
Yes, yes. Thank you, mom.
Okay, perfect. So yeah, so now I want all of you to participate in this